During 2014 EVD outbreak, WHO was sitting on the fence. We saw what the impact of that was. We lost up to 4,000 lives, in Sierra Leone alone. When COVID came, we said, look, we are going to start screening people from the epicenter. We didn't have money put aside for this. It was WHO that was providing money to us for assessing the border, the point of entry, the POEs, to ensure that we are putting things in place, get the passenger locator form printed out. We have to meet the airlines to ensure that people comply. So this actually helped us to be ahead of the curve, ahead of the virus. Because since we are screening people, we were the last country in the sub-region to register a case. So we think we want to attribute this to the fact that we are proactive enough and to make sure with us from the start to the end.
The first year of the Ebola outbreak in Sierra Leone was a struggle. You needed to introduce people to the concept of a deadly viral disease that they hadn't seen before. When COVID came, it wasn't too difficult to convince the people. As you know, outbreaks is a combination of medical intervention and public intervention. So based on our Ebola experience, it was not too difficult to convince people that social distance is required, hand hygiene is required, and the only thing that was new was masking. So whilst other countries were debating and preparing for and struggling with it, Sierra Leone was way ahead of the curve around these mitigation measures.
We see that Sierra Leone is one of the success stories in the world as to how COVID-19 was managed. We did not have so many hospitalized patients. The deaths were low, right? And we were able to manage it and ensure that people go to work. Schools were open, markets were open. We did not have stringent lockdowns like seen in other countries because of the effective collaboration between MHS, WHO, and its health partners.
When we had the COVID-19 outbreak or the pandemic, as a country, the preparedness was already there. I mean, having been reported in nearby countries, we knowing it was only a matter of time, cases were going to come in Sierra Leone. So we were prepared for it. Yes, the resources was not enough, but in terms of responding to the outbreak, I can tell you we were prepared for it. And yes, WHO played a lot of role in that.
We had the manpower available, and then the timing and the funds and the local materials were then provided. So everything, I think, was just in place to just be able to produce a commodity that will be effective against microbial infections. I was lucky to be a part of this team. We came and then we did the training. I think it was a Zimbabwean that trained us, an expert from Zimbabwe. We were trained to the concepts, the principle, and then we also came and did the practicals where we produced alcohol-based hand rub to the tune of 82%, 83%, 79%. But actually our target was 75 to 85%. That is 80% baseline plus or minus 5%. So I believe compliance and continuous usage of these products would help to minimize these cross-infections and other infectious products that will be prevented by hand hygiene.
In a country like Sierra Leone, where there are so many resource constraints, and where very quickly we realized that part of the combination of effective responses that we required to have COVID-19 under control was to have vaccination available to as many Sierra Leoneans as possible. WHO was also central in the support that the UN provided to the government and people of Sierra Leone. Firstly, through the COVAX facility, and so the first consignment of vaccines that were deployed through the national COVID vaccination program. WHO played a role, of course, with UNICEF in enabling those consignments to get into the country and in rolling out the vaccination, national COVID vaccination program. One of the things that you will notice with our response here in Sierra Leone is that we've had to rely on a surge approach. So every now and then, a major campaign is undertaken where we take the vaccines to the people in the communities and not wait for them to come to health facilities or vaccination centers to receive the vaccine because of the ongoing challenges with misinformation and all kinds of myths. But we do know, and we have the experience here in Sierra Leone, that once you take the vaccines to the people, they would bring out their arms to take the vaccines.
With COVID, when vaccines became available and all of these mitigation measures were available, and you have the population in your corner working with you, we're able to contain the situation a lot better than other countries.